our second lecture this year of the Taft Medical Humanities Research Group by Barbara Ramusack. Very briefly, the medical research group here at Taft is comprised of scholars from various Taft departments and a few from the medical campus, increasingly, that have an interest in research that intersects medicine and the humanities. So this is expressed variously in political and sociological contexts, with interests around race and ethnicity, gender, access to medical care, and standards of medical care that are employed as a result of different kind of constructs that come out of the humanities. So just as notice, we have an upcoming talk on the 17th by Shelley Reuter of the African American and Africana Studies Department. It's actually Africana and African American Studies Department on medical humanities here at UC, specifically in the history of medical research as it intersects with the humanities at UC. Today's lecture is by Barbara Ramusack. It's actually a slightly different title than what's on the poster and is posted here. Barbara Ramusack has been teaching at UC since 1967. She's a recently retired professor of history here at UC. She's written no less than 3 books, 8 articles, 6 chapters. Her research has been funded by the Institute of Indian Studies, Fulbright programs, the National Endowment of Humanities, and the Smithsonian Institution. So without further ado, let's bring up our speaker for today. Thank you.
Well, I appreciate very much that Professor Jenkins did bring her class, because I think there are a few hardy souls that I happen to send a notice out about. So I'll vary my talk a little bit from what I thought because of your class in South Asia. Let's see. Okay. Then I go to the next one. Okay. Oh, we've had some technical difficulties. Well, anyway, I'll give you some background on my research career, because I'm not trained as a medical historian. I started in, probably for you, ancient days as a political historian. That was the only thing that you were supposed to do. I remember I was at the University of Michigan, and actually after I came back from India, there was a woman, P. Sklar, who was working on American women's history, and people said, well, she could do that because she had a husband who could support her, and because there was no future in women's history. So I started as a political historian working on the princes of India. Okay. Use these? Okay. No? Okay. Oops. Too quick. Working on the princes of India, and this gives you an idea of the princely states. Covered about 2/5 of the territory of India. 3/5 was ruled directly. And so I worked on what the Indian princes were trying to do to cope with the shift from the dominance of the British, who were their patrons, to the rising nationalist movement in the 1920s and 30s. And then in 1974 at UC, we established a women's studies program. So people said, okay, we need courses. So I said, okay, I'll do a course on women's history. And so I started with my colleague Betsy Sato, and we did a comparative course on women in India, China, and Japan. And I started doing research then on women's history. Again, with no training in women's history. Then wrote some various books, and I'm approaching the end of more or less my active teaching career. And I thought, well, I want to do something different, but bring together my interest in princely states and women's history. And so I decided to work on institutions to improve maternal and infant health in late colonial India. And I was drawn to this topic for 2 reasons. First, when I was studying women's organizations in India during the 1920s and 30s, the topic that got the most controversial and vital speeches within the All India Women's Conference was the topic of birth control. Now, they didn't talk about birth control for themselves, but rather they wanted to set up clinics where poor women could get access to birth control. They didn't talk about that women should have control over their bodies. What they talked about was they wanted to lower the maternal and infant mortality rates in urban areas, that these were very high. And so that was the main goal of the women for giving information on contraception. So there was this theme of maternal and infant health. I also wanted to bring together women and princely states. So I started to look at Mysore state here in the south, which is now the core of a state known as Karnataka, and probably most of you know it because Bangalore is the capital, one of the edges of the so-called IT triangle. So I was going to look at what happened for maternal and infant health in Mysore and in this very large British Indian province of Madras. And so then the general topic was going from the approach of social history that was concerned about gender issues. And I looked at maternity hospitals, which in Madras, the British Indian province, was started in 1844, which is very early, and was known eventually as the Rotunda of the East. The Rotunda is a very famous maternity hospital in Ireland. And this was supposedly the largest maternity hospital east of the Suez Canal. So I looked at maternity hospitals. Then I wanted to look at scientific training of midwives. Now, most of you, if the other people had come, they probably wouldn't have been as familiar with India as you are in Indian social structure. As you know, in the caste system, that one of the principles of where you rank is how pure your occupation is. So Brahmins are at the top, Kshatriyas are next, Vaishyavas, merchants are next, then you have Shudras, and then below the Shudras are various so-called untouchable, scheduled castes, Dalits, depressed classes terms. And as anthropologists say, well, part of it is your purity and your pollution is determined by dealing with human emissions. So for example, a washerman who deals with clothes that might have been soiled with feces or urine is at the top of the social heap of scheduled castes. But people who clean latrines, the so-called sweepers, and midwives are at the very bottom because they deal very directly with human emissions. For midwives, it's the afterbirth. So traditionally, midwives are considered very polluting. They're very necessary for the birthing process, but very polluting. By the late 19th century, there was a movement to have scientific training of midwives. And by that, they meant they would get about 6 months to a year's training on basic principles of hygiene. You know, the need to wash your hands, have some hot water, various things like this, very elemental. So I was looking at the development of scientific training of midwives. Then the third thing were child welfare centers, which were set up in poor slum areas of cities to give ante and postnatal care to women. And then finally I looked at baby weeks. And does anyone know here where baby weeks started? Has anyone ever heard of baby weeks? No? Well, they were a phenomenon that started at the Iowa State Fair. There was a group of club women in 1911 who said, well, we're judging livestock, so why don't we judge babies to encourage people to have healthy babies? And so you had baby weeks with baby contests, and the idea was to promote good health among and good care for infants. And actually, baby weeks in the United States were probably most popular in urban areas for immigrant mothers and in Appalachia, because they were the one place where women could go and take their baby for some postnatal care, because there was no wellness baby exams for children until relatively recently.